when we make a clinical decision to start a medication, we have to take into account the benefits of taking the medication and the risks of the side effects, or conversely, the risks of not taking the medication. So for example, if you're diabetic and we don't treat you, it's pretty clear what's going to happen. So the risk is very high that there's going to be harm. The side effects associated with medication to treat diabetes are real and a potential, but much lower as a percentage than dealing with the actual disease. So it becomes a question of averages or probability. I use the example of using a seatbelt in a car. Not many of us would think of not using a seatbelt in a car because we know it saves lives. In fact, one could even argue, well, what are the chances of you being in a car accident to begin with? Well, it's not as high as we think it is, I suppose, but we want to minimize our risk, which is what we're doing with medication. Well, some will argue that some people are actually killed by seatbelts. So certain types of accidents, if you're wearing a seatbelt, might cause harm. And that's true, but they're in the vast minority. So if you look at how many lives are saved by wearing a seatbelt versus how many lives are impacted by wearing a seatbelt negatively, you'll see that the benefits far outweigh the risks. And I hope I've explained that correctly, but that's essentially what we're trying to do with medications. No medication is without risk.